Hello everyone. Today we are here to discuss one of the major important topic of artificial intelligence, identification of disease drivers for NCD surveillance, non-communicable diseases. So table of contents goes like this: non-communicable diseases and the importance of surveillance, overview of artificial intelligence and its application in non-communicable disease surveillance, AI in improving of the risk factor identification and prediction in the NCD surveillance, AI in disease diagnostic and prediction, AI-driven disease identification, challenges and opportunities, and then references. So first, non-communicable diseases and the importance of surveillance. Non-communicable diseases are actually the chronic conditions that are not being transmitted between the people. They are primarily caused by the modifiable risk factors, which includes unhealthy diet, physical inactivity, tobacco use, harmful use of the alcohol. It includes cardiovascular diseases, cancer, chronic respiratory diseases, diabetes that actually account for a significant proportion of the global deaths and disabilities. They actually involve the ongoing systematic collection and analysis of the data to provide the information on a country's NCD burden, population groups at risk, estimating of the NCD mortality. Surveillance of the NCD is basically very essential for monitoring and evaluating of the emerging patterns and trends. Artificial intelligence has actually proven out to be one of the major importance in the non-communicable disease surveillance, as it actually improves of the diagnosis, treatment, and support in managing of the non-communicable diseases. AI can actually analyze of the large and complex data sets of the medical and health big data to improve of the predictive, preventive, and personalized medicines. AI-based models are actually predominantly deep learning and machine learning are basically being used in order to detect, diagnose, classify, manage, treat, and monitor up the prognosis of the various health issues, including of the communicable diseases and non-communicable diseases. They including of the diabetes, cancer, cardiovascular diseases, mental illnesses, etc. AI also basically assists of the policymakers in developing of the policies and investing up in infrastructure to scale up the exit policies based upon the risk. AI is basically significantly helping in improving of the risk factor identification and prediction in the case of NCD surveillance, which can actually be done by following applications, which includes risk stratification. AI algorithms can actually analyze up the large and complex data sets to identify individuals which are basically at a higher risk for the NCDs. Early detection. AI can actually be used in order to detect up the disease, NCD risk factors, and early signs of diseases. Personalized medicines. AI can actually help up in tailor prevention and treatment strategies to individual patients based upon their unique risk profiles. Predictive modeling. AI can actually be used in order to predict the likelihood of the developing NCDs based upon the risk factors. Population level analysis. AI can actually be used to analyze up the population level data to analyze up the trends and patterns in the case of NCD risk factors, enabling up the targeted interventions and policy development. AI in the case of disease diagnosis and prediction. AI can actually significantly have promise in the case of diagnosis and prediction in the case of various types of diseases through the use of deep learning and machine learning techniques. They can actually be used to analyze up the medical images, for example, X-rays, CT scans, and MRIs to identify the patterns and the features that may actually be indicative of the diseases. This technology has actually been applied to diagnose and predict of diseases, for example, cancer, diabetes, chronic health diseases, COVID-19, etc. The use of AI in the case of disease diagnosis and prediction is constantly evolving, and new techniques have actually been developed or combined to improve the accuracy and efficiency of the medical diagnosis. Some of the major important type of the AI-based applications or the approaches which can actually be used to enhance of the disease surveillance in the case of big data analysis that can further help up in risk stratification and personalized medicines include utilizing of the big data for the process of disease surveillance. AI algorithms can actually analyze of the large and complex data sets to identify disease drivers. Okay, they can actually be used in order to maintain they can actually be included in the electronic health records, medical images, wearable devices, and real world evidence. Machine learning models for the NCD surveillance, they can actually predict up the risk of the NCDs, identifying up the individuals at higher risk. Examples of ML techniques including up random forest decision trees and deep learning methods. AI tools which have basically been applicable for the identification of the disease drivers for the NCD surveillance includes machine learning algorithms, for example, random forests, which have actually been used to predict the spread of the infectious diseases and identifying of the risk transmission pattern. Deep learning models, which are responsible for analyzing of the imaging data for disease classification, detection, segmentation, characterization. Fuzzy K-means clustering algorithms, which are responsible for predicting of the disease risk along with COVID-19 inception breast nest model. Natural learning processing and neural network models have actually been used to analyze of the medical records and electronic health records, and long short-term memory networks have actually been used to predict of the disease progression and mortality in the case of patients infected with emerging infectious diseases. Challenges and opportunities. Some of the major important type of the challenges which are basically been seen is AI algorithms must actually be completely transparent and explainable to ensure that they are not being biased. Data privacy and security must actually be ensured to protect up the patient confidentiality and prevent up the data breaches. The use of the AI in the case of healthcare must actually be guarded by ethical principles, for example, beneficence, non-maleficence, and respect for autonomy. And some of the future prospects and implication includes AI is basically having the potential to revolutionize the disease surveillance, allowing for more accurate and efficient disease Identification. The integration of the AI in the healthcare could actually be used for more personalized medicines tailored to individual patient needs and characteristics. AI can actually help in order to address up the healthcare disparities by improving up the access to healthcare. The development of the AI-based disease surveillance actually requires a robust data curation and analytic algorithms. They can actually lead to job displacement and require new skill sets for healthcare professionals. These are some of the references which have obviously been used for making the presentation. Thank you, everyone.